In fact, my wife, when she wants to get a patient seen, because a lot of the cases are neurological cases. And there's no neurologist, so Prof. Morgan, who retired years upon years ago, he still has to be seeing patients at the hospital. And everybody has cerebrovascular accidents, car accidents, tumors of the brain, strokes are, you know how common strokes are. And there in Jamaica is next to no neurologist. Then there's another Dr. Gilbert, I think Dr. Gilbert took over, right? And then maybe one other one. And then there's a guy called Dr. Ali. He now deals with all the epileptics in Jamaica. So this famous doctor came to Jamaica and he got this bad Parkinson's, very, very, very bad. And could I even get an appointment for anybody to see him? It was Professor Morgan that I had to go to again. All the other people, 3 months. How much time did he have the neurologist? 3 months. So, think of it.
Neurology.
Very good. So there's a lot of scope in neurology. And no end of patients. No end of them. All right. So what are we looking at? Sorry, but I had to tell her that.
Neurology.
No, I have to tell her that. All right. Very good. Good. So we are in the vermis, and that deals with what? Balance. Okay? Balance. Right? And the main input is by the vestibulocerebellum. Now let's see if Deandra can answer this. So Deandra, where are the cell bodies for the first order neurons in this pathway for balance? No, the cell bodies for the first order neurons in the vestibular pathway, in the balance, in the what? Vestibular ganglion. Now let me see if she's hot now. Where exactly is the vestibular ganglion?
I don't know.
Where do you think? Jonathan.
Fundus and internal acoustic nerve.
Hot. But still hot. Fundus of the internal acoustic meatus. That means the very end of the internal acoustic meatus. Alright? Okay? There's a little way to remember it, but I'm not too sure. Okay, I will next time at you, but there's a nice little way of remembering the fundus, but I don't want it, I've looked at it for ages, involving Coke and 7-Up. Coke and, there are 2 drinks, Coke and 7-Up. Yeah, it's like there are 4 little things. And Bell's Bar. Yeah, but I haven't looked at that, but I'm going to take the ENT people soon, so I have to go back and read all of it, go back into it again. Bell's Bar. But don't worry about that. That has nothing to do with it. So this is the what? This is the what? Midline cerebellum, which is the vermis. And the vermis is linked up with 2 other guys called flocculus and nodule. The posterior lateral lobe, alright? The flocculus and the nodule and the vermis. And they receive input from the vestibular, semicircular canals, utricle and saccule. Then no synapsing on the vestibular nuclei. And from the vestibular nuclei via vestibulocerebellum. Okay. And the outflow is going back to the vestibular nucleus. From which nucleus? The fastigial. So the output is called, so as they say, efferents from that area, fastigio-vestibular. Also known as fastigio-nuclear or fastigio-bulbar. 3 names, same thing. Alright? Very good. Very, very good. Alright, let's continue. Okay, so let's do some general things. So in every exam, so by the time you finish, you'll know the whole exam. My gosh, it's terrible. Alright? So there. Very good. So that is in every exam. Alright. Okay, so the neuro pass rate tends to be very good. Believe it or not. Not there. So where exactly are we? Deandra? Genu of the internal capsule. Which important tract pass is there? Corticobulbar. Very good. That's the genu of the internal capsule, right? And let's just put a blue pin in the genu of the corpus callosum, right? And then put the green pin in the splenium of the corpus callosum, all right? So let's pass it around. Very good. So there is the, so that red pin or whatever it is in the genu of the internal capsule for corticobulbar. All right. No. Many times the person wakes up with a stroke. All right. Sometimes they wake up and half the side of the face is all paralyzed. All right. So they have got a they've got a cerebrovascular accident, maybe, and this is the area that there, because the area is a high pressure zone, isn't that so? Who supplies that area? Striate branches directly from the ICA, from the internal carotid artery. So they're high pressure vessels. Okay, and one of them is called the cerebral artery, the artery of cerebral hemorrhage, the artery of who? Charcot. Very good. So the person ends up with a stroke. Now, let's ask a man by the name of Jonathan. Jonathan, how would you distinguish an upper motor neuron lesion and a lower motor neuron lesion as it relates to the facial nerve?
Upper motor neuron lesions of the facial nerve, you get sparing of the upper muscles of the face.
So what area is paralyzed?
The lower aspect of the face.
Same side or contralateral side?
Upper motor?
Yep.
Contralateral.
Contralateral. So it's a contralateral lower side of the face that the patient works up with drooling and that sort of stuff. That's for an upper motor neuron lesion, like here. Okay? All right? Okay? Now let me ask Deandra, where do the corticobulbar tracts arise from? Where on the cortex? Corticobulbar. Jonathan, no.
Parietal.
The lateral aspect of the superlateral surface of the face.
No, Jonathan, no. Think of them homunculus.
Lateral aspect of the postcentral.
Pre-central. So you see, I'm not too bad this evening.
You're not bad at all.
I'm not bad. I must be forgiven by now.
Sorry. You catch me on another bad day.
All right. So it's the lower part of the precentral gyrus, because the homunculus, the man is inverted. Right? His lower limbs are on the paracentral lobule. Reasonable? Okay. So the corticobulbar arise from the lower end of the precentral, inferior aspect. MCQs are there. Okay, on the corticobulbar tracts usually. Reasonable? Very good. And then, so, Deandra, what about a lower motor neuron of the facial nerve? So one entire side of the face. And that's sometimes called a Bell's palsy. Whose palsy? Bell's. Okay? So a Bell's palsy. Okay. So it must be a nice thing to get at. Imagine you get up and you see one whole side of your face. Not a good story at all. Not a good story. Very good. All right. So that is the. Okay. Now. So let's get some pins here. There. An outline, a structure. No. Not that I'm picking an answer or anything a lot, but I'm trying to get his engine going. Get his what? Engine going. All right. Now I see something that's very, very important. But Andrew, what do you think we have shown here? Where is he? Is Andrew still here? Andrew, right here. Here. No problem. No. Just trying to what? Get this, stoke the fires. Very good. So that is a letter U. And that's called the what? Forceps minor. Remember, coming from the splenium is the forceps major. The forceps minor. Now there's a man by the name of J. Mitchell. J. Mitchell. What do you think one of the important functions of the forceps minor will be? Looking at it.
Communication between the two lobes.
So, main connection between the two what? Prefrontal cortices. Very good. Alright, so the both of them will work together. Alright? They have a lot of work to do. Very good. So that's the prefrontal cortices are connected by the forceps what?
Mine.
Minor. All right, let's look at this brain. Look how many times it's been asked in the exam. It's all mashed up now. Very good. All right. All right. Now this question is to who? Shani Duncan. No one else. Very good. Shani, there. Let me see if I find it on another brain. I think. There. Here is done. There it's here. But not so good here. Not really good there.
I think it's
Here. See here again? There. Very good. Optic radiation. What's that structure? Optic radiation. Alright, you must be tired.
Yes.
Yeah.
Yes or no?
Yes.
Well, I'm not. Alright, but we're coming to the end anyway. Just relax. Very good. Alright, three last questions. Three last ones.
Ready.
Alright, three.
One.
Good. And this question now is for
Julian.
No. Alright, Julian. Julian, what's the pin in there? Let's see it there clearly.
Light it up.
Head of the caudate.
Head of the caudate nucleus. Alright. Head of the caudate nucleus. Okay. You said three last questions. Okay. Alright. So this is to Shani. Shani, specifically where is the pin placed? There. Let me put it right there. 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 Last question, while Sean is thinking about that, that last question now is for... Who is that last question for? The last question is for a man by the name of Mike. Mike gets the last question.
That's three.
Yes, and that's it. There. So Mike, here. Where's Shani? Shani, where's the pin in there? She reverse some help.
On the tegmentum part of the pons.
300 marks. Tegmentum of the pons. Excellent. Tegmentum, we call it pons. See the pons? So Shani pons is between here and there. And has two parts. A bare belly, which is a bacillar portion, and a part here called the tegmentum. Alright, and that question is for Mike. Mike, what tracks are located there?
Good, man, good.
Very good. Corticospinal and corticobulbar. It is in the middle of the cerebral peduncle. It's usually in the medial part, the middle, or laterally. Okay, and that's corticobulbar and corticospinal. In the middle 3/5 of the crus cerebri.
Okay.
Alright. Okay, relax now.
That's it?
Time to pack up shop and move on.